This is very exciting.
This is very exciting.
We're getting a number of questions, actually, which is really, really good.
That is excellent.
We can definitely chat about those questions in the discussion area. So, shall we begin?
Yes.
Well, welcome everyone. Welcome to this evening's session. My Health Record for Specialist Practices. This will be an interactive discussion, and as you already know, I am monitoring the discussion pane. But before we do begin, and before I say any further, I would like to do an acknowledgement of country. Northwestern Melbourne Primary Health Network would like to acknowledge the peoples of the Kulin Nation as the traditional custodians of the land on which we're meeting today. We recognize their continuing connection to the land, waters, and culture, and would like to pay our respects to elders past, present, and emerging. So just a bit of housekeeping. As you all know, all attendees will be on mute. Definitely.
Nick, we've lost your sound. While Nick's getting his sound back, I will jump in and keep up with the housekeeping. So in the control panel on the right-hand side of your GoToWebinar, you can see a little orange arrow to expand and collapse the control pane for GoToWebinar. And within that section, if you expand it out, you should see an option for questions, and that's where you can post your questions for this evening. And as I said, it's an interactive discussion, so hopefully Nick's sound will come back on. But otherwise, Katie and I will work through the questions when we get to that point as well in the presentation. So the presentation is going to be filmed, but then I think the panel discussion may not be. I'm not sure about that. I'll have to clarify that with Nick. So to start out with, meet the panel, that's me and Katie. So my name's Kathy Rainbird and I'm a Senior Provider Adoption Lead at the Australian Digital Health Agency. We've been doing a lot of work across the country to encourage specialists to get connected to My Health Record. So that's what I'm here for this evening. And I'll let Katie say hi and introduce herself. Can't hear you either, Katie.
Oh, I've unmuted myself. It just randomly
That's
muted
better.
me.
Now
Hi,
I can
everyone.
hear you.
My name's Dr Katherine Miller. I'm a geriatrician for ARIA Health and a specialist advisor to the Northwestern Melbourne Primary Health Network for the My Health Record. And I've done a lot of work with EMR software over the last couple of years with the Connecting Care project at the Royal Melbourne Hospital. And in my former life, I was a web developer and have a multimedia degree, and I'm very much enjoying putting my past skills to work for us now. So welcome, and it's great to meet you all.
Thanks, Katie. Nick, do you want to try speaking again? Have we got sound back? No sound still for Nick. All right, so it's over to me now to share my screen. So I'll just jump in and start doing that and hopefully make sure, Katie, I might get you to confirm that you can see my slides.
Yes, I can.
Excellent. So to start out, I just wanted to give a brief nutshell overview of what My Health Record is and some of the statistics behind what's happening in the big picture of the system. And then we'll actually do a live demo. So I'll get Katie to post some questions to me about the sorts of information she'd like to be able to find in her patients' My Health Records and what's available. So we'll have a chat about that. And then we'll open up for the panel discussion and your questions. So fantastic that you're posting some questions. We've already seen some of those. Keep them coming and we'll try and get through as many of them as possible as we can within the hour. And if there's anything that we don't get to, or if you have further questions, then please contact Nick at the PHN, and he should be able to respond or assist or point you in the right direction. But to start with, oh, can you still see my slides? Yes, for some reason. Yeah. I can't, which is not very helpful. Just a moment. So just as a bit of an overview, my health record has been created really not to replace existing clinical information systems or medical records, but to provide a complementary system to that, which allows key health information to be shared between different healthcare providers. And I'm sure most of you know, working in the specialist space, that you'll often see patients and not have the full history or the background of what's happened for that person. So having that information available through my health record can be really beneficial and save you a lot of time chasing key information. So in summary, it's an online summary of an individual's key health information. And it really starts out like a blank empty folder, and it's only as the person interacts with the healthcare system and interacts with parts of their healthcare system that are connected and using my health record that information will start to flow into their my health record and grow. But I'll show you some statistics about that in a moment in terms of how much that is growing. It is personally controlled in that an individual gets to choose, firstly, whether they have a My Health record at all, but they can also put some security controls over their My Health record in terms of access codes and so on. And I can talk about that later if you have more interest in that. The beauty of it, of course, is that it's part of a national system, so the information travels with the patient wherever they go and whichever healthcare providers they're seeing. So it crosses state boundaries if you're seeing a patient from interstate, but it also crosses the public and private sector divide. And as I'm sure you're aware, that sometimes there's information that's stored in the public hospital's domain which you can't access in your private rooms and so on. This goes some way to address some of that. The beauty of it as well is that it's accessible at all times. So in an emergency situation, if you can see a person's My Health record, you can potentially get access to some key useful information that you wouldn't otherwise have. And if their GP practice or regular provider isn't available, that can be really useful, especially in emergencies. The other thing to point out is that the system is protected in a number of ways. There are specific design features that the software products that connect to My Health record have to meet, as well as firewalls, secure encryption, and the data storage being held within Australia. So there's a number of levels of different protections in force over the system. In terms of some of the stats that I just mentioned, you can see here that we now have over 22.9 million people in Australia who have a My Health record. As you may remember, we went through a stage where people had the choice to say whether or not they wanted to have one and to opt out if they didn't want to have one. But that's since we went through that phase, then My Health records were created for everybody else. And you can see there's been a steady increase since then as well in people actually opting into the system now. I think some people were sitting on the fence waiting to see how it went and see whether they felt confident with it. And obviously now they are, and they're choosing to have one and seeing perhaps some of the benefits. The other thing to highlight on this slide, I won't go through all the stats here, but just to point out the number of clinical documents that are now flowing into the system. You can see we've got over 122 million clinical documents. And so I guess it's pointing out and highlighting that significant weight of information that's really starting to grow in the system. And making it more beneficial for you as clinicians to access and use the information. There's also information that comes from Medicare, and there's over 213 million Medicare documents. Oh no, sorry, that's medicine documents, and 2.3 billion Medicare documents, I should say. And we'll talk a bit about that a bit further in, but it does include, the Medicare information does include the Australian Immunisation Register, which of course will be more and more pertinent as the COVID-19 vaccination rollout continues. It is mandatory for clinicians administering that vaccine to report through to the Air Register, so that's available there. I'll show you that later on. We've been working closely with primary health networks like NICS and others across the whole country, as well as state jurisdictions and other key partner groups to get as many different healthcare providers connected to the system. Our key focus at the beginning was really on getting general practitioners connected and sharing that key summary information about their regular patients. In the form of what's called a shared health summary, and we can show you one of those later on. There was also been a lot of work done with community pharmacy, and you can see we've actually got 99% of pharmacies now registered, and that means those pharmacies are able to send up dispensing information into the system. 97% of public hospitals are also registered and connected and uploading their discharge summaries. So a large proportion of public hospital discharge summaries are available. We're also working with private hospitals to get them connected. They're sort of starting out and moving along through the journey. And we're also working with pathology services and radiology groups. So you can see here, there are already 91 million pathology reports have been uploaded into My Health Record. So it depends a bit which pathology service your patients have been using in the past, but the beauty of this is that you will be able to see all of those previous reports as long as they have been uploaded into the system. So we'll go through some of those a bit further on in the demonstration as well, but that's just to highlight some of those key facts and figures. This is the range of clinical or different documents that are currently being able to be uploaded into My Health Record. So on the right-hand side here, you can see we've got a range of provider documents. That first one being the shared health summary, which I mentioned, which is uploaded by a patient's regular GP, and all those others that are listed there. So all of those provider documents can only be uploaded by a registered healthcare provider working in a registered healthcare organisation. So you can have confidence when you see those clinical documents that they should be accurate and up to date at that specific point in time. The other side includes documents that the patient themselves can add to their My Health Record. They can add information in the form of a health summary. They can also add advanced care planning documentation into their My Health Record and emergency contacts. So they can all be quite useful. Other documents, as I mentioned earlier, coming through from Medicare include MBS and PBS claims information, organ donor status, and the Australian Immunisation Register, which is where you'll find the COVID-19 vaccination information as well. These documents that are highlighted around this circle here highlight some of the overview documents that are available. They're actually generated by the My Health Record system as you access the person's record, and bring together the information from across these documents into a more easily digestible format, so you can quickly find the information you're looking for. And we'll show you that in a minute in that medicines view, because it's a really handy one to know about. So just quickly, in terms of some of the key benefits for you as specialists, the main thing is giving you access, quick and easy access to key health information that has not been directly received by you. So if it's been sent to the person's regular GP in the form of a discharge summary, you haven't got a copy, you can get into their My Health Record and you'll be able to find it in there. So of course that means less administrative burden, gathering patient information, improved clinical decision making, giving you access to those patient specific information, and potentially avoiding duplicate tests, scans and diagnostics. And of course having access to information that can inform end of life care decisions, which can be really significant as well. So now we're going to go on to our live demonstration. So Katie, I'll get you to unmute yourself and I'll jump out of my slide set and go across to our demo. And hope it hasn't logged me out. No, it doesn't look like it has. So Katie, what sort of things would you generally be really keen to see in a person's My Health Record if you hadn't received the information directly?
Yeah, so in my practice in the community as a geriatrician, I frequently come across the situation where I don't have an up-to-date medication list, or the GP summary one sort of lists everything but not when or if they're taking them. So the latest the latest list of dispensed medications is something I've found really useful in my health record. We can take a look at.
Yeah, sure. So this is, we've got a software simulation environment. It's actually open access and you can go in there and have a bit of a play without mucking up a real person's My Health record. So this is a fictitious patient we have in here. So we'll just click on his My Health record. So this is just a mock pretend version of the software called Genie, which I understand quite a lot of specialists use. So that's why we chose to use that one tonight for this demonstration. But in this software simulation environment, we do have a range of other softwares as well. So if you wanted to have a bit of a look, you can go in and have a look at those as well. So when you first click on the My Health Record tab in your patient's record through Genie, it looks like there is nothing in this person's My Health record, but that is because there are these filters that have been set on the side here, and you need to adjust these filters to bring in the documents that you want to see. So they do have the option to just select the last 3 months worth of documents, and that could be perhaps relevant if you know that the person has been in hospital recently and so on. But for this demonstration, I'm actually going to expand this date range right out because I know that this pretend patient has some fictitious documents that are quite old. So I'll go back that far and I'll just put in today's date for the to date, so we get that whole range. And then the trick, after you've adjusted your filters accordingly, you can also search for specific types of documents. So if you were just looking for the discharge summary, you could just click that and click view get the view document list. So let's try clicking on that view documents now. And it just takes a moment to load because it has to contact and pull them in from the online storage. So it just takes a little while to load. And there's our list of documents that are available for this patient's. So at the top, you can see there are those overviews that I mentioned on the previous slide, where the system is actually generating those in real time. So you can see they've got today's date on them. And as Katie said, she wanted to see medicines. We'll go into the medicines view. This is a really useful overview document. As you can imagine, there could be a number of documents across a person's My Health record with medicines information in it. So it could be in discharge summaries or shared health summaries or other documents. This brings any available medicines information from across the person's My Health record and puts it onto one screen so you can quickly and easily see it. Across the top here, there's a navigation panel, and the first one that always appears is allergies and adverse reactions. And you can see that's listed underneath with that pink highlight. And you can see the substance and agent, the manifestation, and over on the left you can see hyperlinks through to the source documents. So if we want to see a medicines list, we click on medicines preview, and you can see the lists of medications here. It's not fully populated because, as I said, it's a fictitious patient, but you can also sort by active ingredients. And you can see the dose and directions and dates and so on. And again, hyperlinks on this side to those source documents. The other thing you can access through this medicines overview page is the latest shared health summary for the patient and the latest discharge summary. So if we click on the shared health summary, we have to bear in mind when it was last uploaded, but you can see this was done in June 2019, and this would be the doctor, their regular doctor's name here. So you can see again a list of adverse reactions, and this sort of format is the format that all the documents that come into My Health record have, this standardized format if they are generated through the system into atomized data. So we've got adverse reactions from this patient's shared health summary, medications, medicines list, medical history, and if we scroll down a little bit, if I can carefully do that without mucking the toolbar up, medical history, and some immunisations. I should point out that the immunisations listed here will only be the ones that were provided at that specific practice where this shared health summary was uploaded. So you just need to bear that in mind when you're looking at that immunisations list and probably would refer to the AIR list as a more complete list of immunisations rather than relying on that listing there. So that's the overview of the document that I called the medicines document. I'm just making sure, oh, sorry, clicking the wrong cross there. So the other way you can find medicines information, I'm just going to try and make this a little bit smaller so I can hopefully show you another aspect of this. Let me just try making that bigger. Oh, no, it hasn't done what I wanted it to. Okay, so Katie, you mentioned about being able to see prescribed and dispensed record information. So there is a button down here in Genie which actually refers to that specific view. It's the acronym is National Prescription and Dispense Record View. If we click on that, you do need to make sure you change the selection for prescription and dispense, otherwise it brings in the Medicare overview about prescriptions. And again, I'm just going to expand that date range to make it more interesting for the demonstration. And we'll say get document. So that was the Medicare overview that we just saw flash up then. We're pulling in now that prescription and dispense view. And you can see the medications listed here, and clicking on a specific one, you can see when it was prescribed and then when it's been dispensed. So that would give a pretty good indication of whether they've been hopefully getting their script filled, but also whether they've been taking their medication. Of course, you still need to ask them the question. Potentially they'd be getting a script filled and forgetting to take it. But yeah, that gives you a pretty good starting point and at least a bit more information than you might have otherwise had. Katie, does that sound interesting to you? Look interesting to you?
That is immensely helpful, I can't tell you. The other thing I think that I think is very relevant is the discharge summary from the local hospital, because more often than not I'll have someone who come into me and say, I was in hospital last week, I'm not really sure what they did for me. I don't really know what happened and I don't have a copy of the discharge letter, and I don't want to reinvent the wheel, and I certainly don't want to do things that have been done before.
Yep. Certainly that's the beauty about having so many hospitals connected to the system now and uploading those discharge summaries. So let's, as an example, here's one listed in our fictitious patients list. Double clicking on discharge summary should open it up. Sometimes it has a little bit of a lag at my end, so apologies if that's a bit slow coming through. And so in this instance, the discharge summary has actually been attached as a PDF. So there's two different ways that documents can feed into the system. One is in this standardized look, which some discharge summaries come in as, but other hospitals are doing it as a wrapped PDF. And so if you see a little hyperlink, click on that, and then you can open, and it takes you straight through, and there's that discharge summary for his visit to hospital back in June 2019. And we can scroll down to read the details. We can save a copy, download a copy, or save it. And we can see that he's presented with swelling of his leg and had a deep vein thrombosis. You can see the medications and the plan. So again, Katie, is that the sort of thing that yeah,
it's certainly
exciting for you?
it certainly bypasses the palaver of having to fill in many forms to access this information as we currently do.
Yes.
The only other thing I wanted to sort of draw everyone's attention to was the uploaded pathology and imaging. Again, in the interest of not reinventing the wheel and doubling up and doing unnecessary tests that have been done before, these go in here too, which is amazing.
Yep. Exactly. So you can see down the bottom of our patient Xavier's list here, he's actually got a number of pathology reports in there, which previously you would have had to sort of click through onto each one to see what they were for. But like the medicines view, we've created a pathology overview. So it brings all of those listed reports together and displays them on a screen for you. So if we double click on that pathology overview, and just open that up. Again, it's dependent on the labs being connected. So whether they are uploading those reports or not is dependent on whether they've already connected to the system. But we do have a list of those connected labs on our webpage, and I'll put up the link for that in a little while. But you can look up your local providers and at least see if they're connected. And encourage your patients to get their tests done at those that are, because then their reports will go up. So one of the things you can see here, the tests are grouped by test name and ordered by specimen collection date. So you can see all the tests here. If they'd had multiple tests, there'd be the other links to the reports here. Say we wanted that full blood count, we just click on the hyperlink to the report, click open, and straight away you've got access to that pathology report that was already requested by somebody else.
I think you nail it when you say requested by somebody else, because at the moment you sign up to a lot of laboratories' information systems, but you frequently can only see what you've ordered, and
Yes.
accessing other people's information takes more time than is often worth. So this cuts out a lot of that noise, which is excellent.
Yeah, that's really one of the main reasons why it was created in the first place, was to enable that. And like you say, any report, whoever's requested it, it's available straight away once it's finalised, once the report's finalised and provided the lab's connected to the system. But once they complete their report, they still send it to whoever's requested it as per their usual process. But the lab will also default and automatically send it up into the system. So then it's immediately available for any other healthcare provider that that person sees. Patients can log into their own My Health record as well and see all of the clinical information, the documents that are in there. But with pathology reports and diagnostic imaging reports, when they're finalised and uploaded, they're uploaded available straight away for healthcare providers, but there is a lock put on it so the consumer or the patient can't read it for 7 days. So there's a 7-day delay before they can open it and have a look. And that's to give their regular doctor time to review the results and contact them as needed.
I actually think you just touched on a really interesting point there when you said that patients themselves can read their own clinical information. And with respect to the discharge summaries, I think any specialist watching this evening who is supervising junior medical staff probably just want to be checking those discharge summaries before they go out too, and checking the language used in them, and making sure that it is something that as a patient you'd be okay reading.
Yeah, exactly. That's a really good point. Yeah, being conscious of the fact that now that information is much more shareable and likely to be visible to patients is something really important to consider when you're creating those documents. So I guess the other thing to point out is all the other documents that are in here. There's quite a range. Advanced care planning information. I mentioned about the Medicare documents, which includes the Australian Immunisation Register listing. That can be found, at the moment, it's found through this Medicare Overview All button. But there is a change and enhancement coming to the system. We've been working in the background quite hard on making sure that that immunisations information is a bit more visible. So like we've got that medicines view and that pathology overview document, there's also now going to, at the end of next week, I believe, be an immunisations view. So instead of having to go through the Medicare side of things to find that immunisation information, it'll be a bit more front and centre, and you'll be able to just click on it and see it. It will also have a notification which indicates their COVID vaccination status and also when their next dose is due, I believe. So that's something to watch out for. So Katie, was there anything else you would like me to demo while I'm here?
I wouldn't mind if you just show an imaging report. I think so everyone can see how that looks as well.
Yeah,
I saw
sure.
a diagnostic imaging one down there somewhere.
There is actually a diagnostic imaging overview section as well, so you can actually pull that up the same way that you can with the pathology reports. And you get a list of all the imaging that's been done. A lot of the results from diagnostic imaging are just the report, not necessarily the images at this stage. Some services are uploading some images somehow embedded into their documents, but this is just an example, and I don't even know, it might even be so fictitious. Oh no, it's just that report there. So again, I think I skipped a bit quickly over that, but that you get that straight away, so that's pretty cool. So again, that's grouping those reports so you can quickly get to the one you want. This guy's only had the one, but if they'd had multiple tests, you'd be able to quickly see which one you wanted to access.
That's great.
Kathy?
Hello.
We can hear you, Nick.
Oh, thank goodness for that.
we
have
can't see
sound.
you, but I can see you.
Well, my apologies for my absence, everyone. I was in the background trying to figure out my sound and everything, but hallelujah, I am back. But
well done,
I did want to ask you, because you were touching on all of that stuff, is there an actual plan to get some images? I saw a question by someone here. Is there a plan to get images or real images on the My Health Record database?
I think that will come with time. At the moment, as I said, the majority are just the reports. Some have got smaller images embedded within those reports, but it depends on the lab itself or the diagnostic imaging provider in terms of, and it's also a bit to do with the size of the data files that have to get uploaded to hold that imaging. So that's a bit of a work in progress, but I think it will come over time.
Thanks for that. Appreciate it. Katie, I actually wanted to start off with you. Are you currently, I know that you've done quite a bit of work in Royal Melbourne. You were like the, I forgot the actual name of it, my apologies. You were the lead trainer, something like that, lead medical trainer.
I was a medical lead for Site Go Live, but yeah, that's different.
There you go. My apologies. I know that you're using the My Health Record there as well. Have you found this useful in your daily practice? Were there any examples that you can give? In terms of barriers and challenges as well. I think one of the biggest things that specialists are worried about is like workflow. Is this going to help my workflow? Is this going to be a hindrance? All that sort of stuff. So it'll be awesome if you can shed light on that.
Yeah, sure. Very happy to. Look, from the public hospital end, the Melbourne Health has just transitioned to a new EMR which integrated with My Health Record, and look, it was immensely useful once that was up and running, because not only were we off paper, finally, we had access to all the other we had access to all the other discharge summaries from all of the hospitals feeding in. And I think, working in any hospital, you've got patients who are often quite complex, with complex medical histories, and often you sort of come in with nothing. And to have all that information available was indescribably helpful. And more often than not, I'd also find recent pathology and imaging and dispensing records and all these things that, to the best of your efforts, you try to get from the patient themselves, but sometimes at 3 o'clock in the morning you just can't, and it's there. So that is probably the best thing that I've found, is just the immense amount of information you have for your patients at any given moment is probably the best thing about this. The biggest barrier at this point in time would be the setup and the software compliance in the community. So when I first started looking into this, and I had a look through all the steps involved with the setup of My Health Record, especially in private practice, there's a lot of information and it can be quite overwhelming. But I think if you just make the steps that you're supposed to do, so set up your Proda account, which helps you anyway, because you can instantly get new provider numbers and order script pads and things like that. You don't have to send in forms to Medicare anymore, so you should do that anyway. But once you get that set up, you can speak to your practice manager, and they love it. They really want this. It helps their job. It helps their workflows. Once you've done your end, they can more or less do the rest. And it does take a little bit of time. Yes, it probably does take a little bit of time on the phone, but I think it's ultimately worth it for the reasons mentioned above. You just have more information about your patient that you never otherwise had access to before.
Thanks for that, Katie. I appreciate that. Kathy,
Nick, that
over
actually
to you.
segues quite nicely into my next part of the slides, which just cover off some of that aspect of private practice and getting set up. So would you like me to run through that now, and then we can come back and have more discussion?
Yeah, we might as well touch on that. Kathy, go for it.
So in the hospital system, as Katie touched on, they're usually set up already to enable viewing. So if you don't know how to do it in your hospital systems, perhaps have a chat with your health information manager, or I don't know what they're called in Victoria in terms of who. Katie, can you help me? Who would be the person in the hospital?
I just find the nearest resident. I'll tell you that. But look, it's even with it, when we went through the transition, it was only just last year. My health record wasn't featuring heavily at that point in time because everyone was just getting used to the new system. I just kind of took it upon myself to find it. But most hospitals in Victoria are still fairly new to Cerner or Epic, which are the two big ones that are accessing my health record at the moment. Apologies if I've missed another major one. But there is always someone around. There's always a super user or a trainer or someone around who will know. Someone will have a reputation for being the guru, and
But in private practice, you can there's two ways that you can access the system. So you can use your software, clinical software system, if you use one, as long as it has already met those design features that are required to connect to my health record. We're actually engaged at the moment with a whole range of specialist software product vendors. So the producers of the software, and they're making changes and improvements to their software as we speak. So, and more of them are becoming integrated with my health record as well. The really great thing about that is that they're actually working towards being able to upload specialist letters directly through their systems as well. So that will then just be part of the workflow of completing the letter in your software. It'll be sent to whoever you're usually sending it to, and as I said, like the labs, it will also then go up into the My Health Record if you want it to. The other way you can access My Health Record is if you don't have software that's conformant, you can use what's called the National Provider Portal, and that's accessed through PRODA, and that gives you viewing of the system. So you can't upload information through that PRODA Provider Portal, but you can at least view and find all of that useful information that Katie was talking about. So there's those two different ways.
I will just speak to that quickly, Kathy. Just with the National Provider Portal, you do need to be associated with a health organisation to use it, which probably need your practice manager to help you set up as well.
Yeah. So this is a list of the specialist softwares that are working towards that compliance. In fact, this is the first round of that. There's two tranches. So these ones are about to, if they haven't gone live, they're about to go live with their integrated software. So if you have any of these ones, you're in a good space. And as I said, they'll be integrated to have that medicines view that I showed you, the pathology and diagnostic imaging view, and the seamless upload of your letters, as well as uploading of prescription records. So 3 of those products have already gone live and have launched their integrated products. And as I mentioned, we also have a second tranche industry offer underway, so other softwares will be coming on board with this as well. So that's quite exciting for those of us who are into that sort of thing. In terms of the key steps in getting set up in private practice, this slide really just outlines that overview of what you need to do. So you need to, firstly, in private practice, you do need to ensure that you've got a My Health Record security and access policy in place for your organisation. And the good news is that the RACP have just published one. So there's a link here which will take you to their resources list. And if you scroll down that page, there's actually a template set up which you can just adapt to your organisation. You do need to register your organisation, as Katie mentioned, to get connected, and Nick can help you with that. They're actually there to assist, and so you can give him a call and he will actually come out to your practice and guide you through that process if need
Kathy,
be.
I was actually going to jump in and say something. Katie, this would be a really good question for you actually, and this would be really, really again, a really good segue, actually, learning from you, Kathy. What advice would you give like a specialist, a practice, wanting to adopt digital health tools, like the My Health Record, all that sort of stuff? What is, if you could truncate that process as much as possible, what is the advice you would give them?
Well, I think if you want to adopt these tools, and digital health is a sort of a really big umbrella term, but if you want access to patient discharge summaries, recent pathology, and imaging, and not have to go through an immensely long paper trail to do so, what I would suggest, first step is checking that your software is compliant, and it may not be. And if it's not, then make sure you've got a CRODA account. Speak to your practice manager about getting your organisation registered within CRODA and connected to yourself. And if any of that is difficult, contact Nick and he will help you with that setup, and he will help your practice manager too. I'm handballing that back to you in a little way there, Nick. So, but it's just okay. try not to be overwhelmed by the truckloads of information there is about this. What you want to do is just set it up. So if your software is not compliant, that's okay. You can still access the National Patient Provider Portal and get all that information anywhere. You just can't put any information in it yet.
So we have lots of guidance resources, and it can be really overwhelming, but one of the ones that I'd like to point out further down here is the specialist toolkit that we have, specially developed for specialist practices, which includes a specific section on My Health Record with printable guides on how to get connected and set it up for your organisation. So really would recommend, if you need that support, to start there. And as I said, to reach out to Nick, but also we have an agency helpline, which we have a specialist connection team. So if you call that 1300 number or email help, they will get in contact with you and guide you through those processes for actually getting set up to start with. But yeah, as Katie said, the main thing is that is a bit of a process, but once it's done once, then you're set up and ready to go, and then it's just a matter of getting used to using the system and making sure you and your staff have got a bit of training so you understand how to use it and find all the bits that you need.
And don't be shy in asking for help in setting this up. This is new for everyone, and it's a very big change to the way that we do things. So don't kind of read all the information, try and set it up and fail and give up, because it's not you. It's a new way of doing things. So reach out and get some support to do it. It's all it's all free. It's there for the taking.
Awesome. Thanks, Kathy and Katie. Both your names start with a K. Both your full names are also Catherine, and you're both doctors. This is really hard as a host. I just had to put it out there.
You're doing great. You're doing great.
I just get so confused. But Kathy, I actually had a question for you. Like, all this is really awesome. All this sounds really fantastic. And Katie, I appreciate you sharing your thoughts as well. I mean, from my experience, from my work, speaking with something like over 600 specialists within the northwestern Melbourne region. Yes, Katie, that's not including you as well. I think one of the questions I get asked quite often is, okay, great, if I have access to that, what are the GPs contributing? I hear this, I hear that. What are they actually putting into the My Health Record that would be useful for me as a I'm not a specialist, but from the specialist perspective, what is useful for me? What can I actually see? And what are the things
coming from them,
that will be useful to my practice?
Katie's already highlighted the benefit of being able to just get those discharge summaries that you wouldn't usually directly receive, as well as the pathology reports and so on. But from general practice, the two key documents, sorry, my dogs are just barking, two key documents that they're involved in uploading. One is that shared health summary, which I mentioned before, which not all patients will necessarily have one, but if you're seeing someone who's got chronic complex conditions, I'd be saying to them, hey, you know, if your GP had put a shared health summary up in here, I would be able to see that. So it's a bit of a, you know, encouraging them by stealth, if you like. And yeah, especially for geriatric patients, Katie, I'm sure you would have lots of patients who don't remember everything, and poor historians potentially. And if their GP had put that shared health summary up, it would be really, really useful for you.
It's so helpful. It's so helpful.
Yeah.
I have a vested interest here. The more information I get up on this system, the more it helps me.
Yeah, and I think there has been a real focus initially on GPs to actually start doing those shared health summaries, but they saw it as they were doing all the grunt work and doing the uploading because it's an active upload for them. They have to actually click a few buttons to make it go. But they weren't seeing the return at that stage because not all of those other providers were connected. So we're doing a lot of work now with them to say, hey, but look at all this stuff you can find in the system now, what's useful for you, but also look at all the hospitals that are connected and all the specialists who are connected now, and they want to see those shared health summaries from your end. So make sure you're putting them in there, especially for those patients who are frequent flyers in different parts of the healthcare system.
And they so that's in my experience. They are putting them up there. There's a lot of shared health summaries in there now. Yeah, from my experience using it for my older patients, definitely.
Yeah, that's fantastic. And some jurisdictions are doing work already to get other specialist letters going up from their outpatient clinics as well. So that will be really useful. If you're seeing someone who's seen multiple specialists, you'll actually be able to find those letters as well, which will be beneficial for you. So the other document the GPs can put up, so I'm getting distracted by other things, is the event, what's called an event summary. So that's more for a one-off event. So if a patient goes to a GP practice that perhaps isn't their regular practice, but has something significant that the clinician thinks, yes, I'd like other people to be aware of this, they can upload it in the form of that event summary. So it's more for one-off incident or event.
I think we've got a few questions.
Yes, we do. I was actually going to circle back to the process of registration. I guess from a high level perspective, maybe for you, Kathy, I have a question here, and the question was basically, does a practice need a Proto account, or does each specialist need a Proto account? It'll be good to get some clarification on that.
Yeah, so again, it depends how your practice is using the system. So if you are using conformance software, the practice principal or the owner of the practice should have hopefully already have a Proto account, but set up a Proto account, and they're the ones who would go through the process of registering their organization. So they're the person who's responsible for the business, and so they're the ones who have to go through that initial setup. So once they've registered the organization, if you're using conformance software, none of the other providers necessarily need to have a Proto account if you're in a big practice, but they do need an identifier number that has to get put in the background of the software. So once they can get that number just by contacting AHPRA. It's called a healthcare provider identifier number for individuals. That gets put in the sort of user settings in the background of the software. To enable that to be seen. So they don't all need their own separate Proto account. However, if they're accessing through the provider portal, they will need to have their own Proto account because they'll need to be able to log into it through there. Does that answer?
I would recommend getting your own Proto account as a specialist for this reason. We move around a lot. You might want to access it from somewhere that's not, your own practice. For example, maybe you've got a couple of roles, one's in a public hospital, one is at a separate practice that isn't set up. If you're using it primarily to view information, my recommendation would be to set up your Proto account and link it to an organization, so then you can really access it anywhere.
Yeah, that's a good point. Thanks, Katie.
Thank you very much for that, Kathy and Katie. I believe we've already touched on the plan to get images on the My Health record, as well as uploading letters in PDF format to the My Health record. I believe we've already touched on that.
Yeah, so again, it depends on how the software sets that up. As I said, the software vendors are working towards that, so it depends on how they finish it in their systems as to how that will be sent. But basically, every document that goes up is either in the format of a locked PDF or what's called a CDA, Clinical Document Architecture Structure. So those two different types of documents are the formats that are available to be uploaded. And the other thing to point out is that patients can't edit those documents. So once they're uploaded, they aren't editable. So no one else can interfere with what you've written, just to reassure everyone.
I actually have a question around that. If someone receives a diagnosis that later on isn't really relevant or perhaps isn't even correct, if that's on the record forever, is there any way a health professional could correct that?
Yes, there are a number of different ways that information like that can be corrected. So the first one is that the patient, as I said, can go into their own My Health record and see that information. And if there was something that was inaccurate, they can actually hide that specific document or even remove it if they wanted to from their My Health record. There is that 1300 number. There's the 1800 number for patients to call as well if there's something inaccurate. And if it's a clinical safety risk, I would recommend calling that 1800 number straight away and saying that it is a clinical safety issue. And they can then get into the system through the back end and remove those documents if needed.
Thank you.
If you've actually uploaded a document yourself, if you were the one who put that diagnosis in, there is a way that you can do it through most of the software systems. They have to have the ability to remove information as well. So it's a matter of finding out how you do that in your existing system. In Genie, which if I can get back to my screen from before, oh, it's disconnected me. There is a button which is a remove authored documents button, which means you can take that document that you've uploaded and take it down again. So you as the author of that document can remove it, but other healthcare providers can't. Nick, I was
Kathy,
just also going to point out this list here. I think there was a question early on about diagnostic imaging connections. So this link here has a whole list of all the connected services. So if we scroll down a bit, we can see all the different states. So we need to get to Victoria. Scrolling.
I think one of the biggest surprises, I guess, when I speak to a lot of specialists is that I think a lot of us don't actually know how much resources is out there already on the My Health record in terms of statistics, in terms of who's uploading, in terms of how to actually register, all that sort of stuff. So I think what will be really good is I will compile all these links and then we can send them off to our attendees to help you all register and, check out all the stats and everything like that.
Nick, I'll just pop that link for this particular page into the chat pane now so that if anyone in the audience wants to check it out, they can.
Much appreciated.
Hopefully that's worked. And you can grab that link and share it through your emails as well. And the other one that is on a similar page to this is the connections in terms of hospitals. So which hospitals are connected as well. So there's a second page here. There's the public hospital list there. And there's a full list. If you click on this PDF, it'll actually give you the full breakdown hospital by hospital and what they're currently enabled to do. So again, I'll pop that into the chat pane.
Kathy, and I think it'll be cool to hear from your experience as well, Katie. Something that I've heard as well is when using the My Health record, I believe what I've heard is just before utilizing the My Health record, one of the things that the practice or the specialist has to be mindful of is confidentiality, all that sort of stuff. And I think that's also like one of the biggest concerns confidentiality, security. I believe you touched on that before as well. But in terms of like policies, is that something that a practice would have to implement? I mean, in terms of policies, training, education, flyers, all that sort of stuff.
I think
That's something that's.
I think data, consent to access someone's data via My Health Record is really important. And again, I will make the point that this is all new for everyone, this way of doing things, because in the past, medicine has been largely paper-based for a very long time, and this is still a big transition for everyone. So data privacy and consent is really, really important. There are quite a few people out there who don't necessarily want everyone to see their records and are very, very cagey about My Health Record, and that's absolutely to be respected. But in order to engender trust, especially, and also because we should, it's really important that your practice, if you do use compliance software, has a consent form that a patient can sign that allows you to access their information on their behalf. It's no different to accessing a discharge summary from a public hospital where you have to get the patient to sign a form saying they consent to you accessing it. This just replaces that, and it becomes a single one-off consent to save you having to do it all the time for multiple different stakeholders.
Katie, can I just add to that? There actually is legislation that specifically covers the use of My Health Record, and you don't actually have to seek consent to view the record for your patients. It is good practice, and as Katie said, if you have it as part of your sort of consent form at the beginning of, the first time you see a patient, are you happy for me to view your My Health Record? That's great, but you don't have to. You actually have authority to view the record as a healthcare provider as long as your organisation is registered and you are providing healthcare to that person. It's recognised that it's there for that purpose, as long as you're using it for that legitimate purpose, and as Nick said, your organisation has an appropriate policy in place behind it and that you've had the appropriate training, then you do have authority to view.
Well, thank you very much.
I just wanted to point out, this is the Digital Health Specialist Toolkit, and there are some really helpful printable guides in here. So if you click on this drop-down menu, there is a section specifically about My Health Record, which you can work through. But if you want a shortcut, you can just go to the printable guides list. And there's some really useful, just really specifically for specialists. There's the fact sheets, FAQs, an implementation guide, which takes you through all of that background in terms of what you need to have in place and how to go through the process, as well as user guides.
Very helpful.
Thank you very much for that. That is very helpful. I do have
any other questions?
Yeah, I do actually have a comment here from someone. So this person, I believe, potentially is mentioned that they've been accessing the My Health Record, but there has, from this person's perspective, lack of uploads from hospitals, pathology and imaging. Seems like a lot of work to log on. Do you have an idea when these providers will increase their uploads?
So that list that I shared before, I think is quite extensive in terms of the pathology providers and diagnostic imaging providers. It is growing every day. We've just recently had one of the big private providers connect. So they may not have that background of pathology reports from, say 6 months ago, but from now on, you'll continue to see those reports coming in and that list continuing to grow. So there are more and more of those clinical documents that save you so much time. So even though it is a bit of an effort to get set up, I think as Katie highlighted, in terms of the amount of time that it then saves you in chasing that information, it's really worthwhile.
Yeah, and look,
I think this is just, Katie, go for it.
Not everyone is opted in to My Health Record as well. So this isn't going to appear for every single patient you have on your books, but when it is there, it's excellent.
yeah, I think this is very much like the iPhone, right? Slow and steady. And then now you have the iPhone version 12, which is pretty good, which is very amazing. But anyways, it is 8:01. Thank you very much to everyone who has attended the session tonight. It is amazing having all of you here, especially on a wet day like this. But anyways, thank you very much. There will be an evaluation survey just after this, so it would be kindly appreciated if you could fill that in. But otherwise, thank you very much for attending to everyone. Thank you very much, Katie. Thank you very much, Kathy. And have a good night.
Thanks, Nick. Thanks, everyone.
Thanks.